Our next exercise in this progression is stair step downs. This comes next as it requires a great deal of strength and control to maintain good knee stability and support one's full body weight. To complete this exercise, the patient will stand on the edge of a step with one of their feet planted on the ground. They will keep the other foot hovering over the edge of the stairs. The patient will then slowly bend their knee on their planted leg and lower the hovering leg enough to tap its heel on the ground. This exercise targets the quadriceps, glutes, and stabilizing muscles of the lower body and hip. In addition to this, it works to help the patient practice functional movements like walking on the stairs, as well as any knee flexion movements like squatting, sitting down, etc., to help return to a normal or improved range of motion.
This exercise is performed in the sagittal plane. The primary joint movements are knee flexion and extension with a slight dorsiflexion of the ankle. The secondary joint movement is hip flexion and extension. During knee extension, the prime mover is the quadriceps and the antagonists are the hamstrings. When performing knee extensions, the quads are contracting concentrically, moving left on the LTR curve, whereas the hamstrings are contracting eccentrically, moving right on the LTR curve. For knee flexion, the roles are reversed. The prime movers are the hamstrings, where the antagonists are the quadriceps. By flexing the knee, the hamstrings are performing a concentric contraction, which moves left on the LTR curve, where the quadriceps are contracting eccentrically, moving right on the LTR curve. The following muscles are used for stability: the gluteus medius and maximus, which helps prevent hip drop, which is a common mistake; the rectus abdominis and transverse abdominis, which is important for core and pelvic stability. The tibialis anterior and gastrocnemius and soleus are the main muscles used to help ankle stability. For this exercise, it is ideal for the patient to start at 0 degrees for full extension. When performing this exercise, it is best to let the patient flex their knee as far down as they can with no pain or discomfort. So it's best to have them flex to about 90 degrees or less. Throughout this exercise, the 3 muscle contractions are used. Concentric contraction occurs in the quadriceps when the knee is extending. Eccentric contraction occurs when the quadriceps are performing knee flexion. And finally, the core, hip, ankle stabilizers all perform isometric contractions to stabilize the body.
Common mistakes made during this movement involve the knee caving inward, rushing the descent, using the wrong step height, leaning too far forward, and pushing off with your stable foot. To prevent the knee caving inwards, make sure to keep a straight line between the hip, knee, and ankle to prevent engaging the glutes and quads. Instead of rushing the descent, try to count to the number each time you lower your leg. This helps maintain a good form and engage the proper muscles. Make sure to step height is one you are comfortable with, and where you are not overexerting yourself. It is common when first beginning to start with a shallow step and work towards a taller one. Instead of leaning too far forward, try to keep an upright posture to engage all trunk muscles that are needed.
This is Mackenzie, and she is going to demonstrate this exercise. As you can see, she is keeping her right leg fully extended and hovering over the step below, while her left leg is flexed at the knee to help stabilize herself. While she is performing the movement, she is tapping the heel of her foot to the step below her and then immediately coming back up. She is completing 5 reps on each leg. As you can see, she is flexing her stance leg as far as she needs to ensure that her extended, hovering leg taps the step below. Thank you, Mackenzie, for all your help. To prevent further injury, it is best to use a stable surface that can hold your body weight. Maintain a good posture to help control the movement, stretch beforehand. If needed, utilize handrails for extra support. To further this exercise, try increasing the step height to increase flexion in your stance knee. You can also add weights to further the difficulty. And practice regularly to improve your range of motion, but always remember not to overexert yourself. Take it slow and stop when there is discomfort. For stair step downs, you will alternate from using your injured leg as your stance leg and a hovering leg to improve the range of motion for both legs. The primary movement is knee flexion and extension. Stabilization is one of the most important areas during this exercise where all the movements are used. Be sure to use the correct alignment while performing this exercise.